All right, everybody. Welcome to another episode of Achieve 10X TV. My name is Jimmy Yin. I'm a licensed acupuncturist, herbalist, and nutritionist. And this is the episode of where I go and interview health experts around the world. And today I'm super excited to talk to and interview Chris Mills from Australia. So Chris, why don't you introduce yourself to the public?
Yeah, thanks a lot for having me, Jimmy. So I'm Chris Mills. I'm also a licensed acupuncturist and Chinese herbalist, and I practice from the Yarra Valley in Victoria. So more specifically, I practice from Yarra Junction, and I also practice from Lilydale. So thanks for having me today.
Yeah, I'm excited to learn about, especially your topic. So, let me just start with, about you. So how long have you been an acupuncturist?
Since 2007.
Oh, wow. Okay,
So a
nice.
little while now.
Yeah.
Yeah.
So, one of the things that, you specialize in is treating pregnant women, right?
Mm-hmm.
So
Yeah.
how did you get to, this specialty? How did you get to becoming an expert at this treating pregnant women?
I guess part of it did start prior to my own wife being pregnant. So I have two kids now. I've got a 5-year-old and my daughter is almost 2. So that would have been a big component of that.
Yeah.
But it started probably back in 2008. I think actually being pregnant can be like a really special time in a woman's life.
Yeah.
And if we can get acupuncture to actually improve the quality of the pregnancy and actually make it a much more of an enjoyable experience, then, that's kind of beautiful.
Yeah, definitely. And so, when someone's pregnant, at least here in the US, they are not necessarily thinking about acupuncture. So how is it in Australia? Are women open to getting acupuncture during their pregnancy?
They are. I find that a lot of women don't necessarily know about how acupuncture can help.
Mhm.
And they don't. So often the point of call that I get from women is kind of, labor induction.
Mm.
And thankfully, I get quite a few now who are kind of going, I've got a vaginal birth after Caesar plan, so VBAC. So they're actually calling earlier
Nice.
before they're 40 weeks to kind of go, is there something that we can do about it?
Yeah.
And yes is the answer.
Okay, nice. So if you can share with the audience, because like here in the US and it sounds like in Australia, pregnant women don't know that acupuncture can benefit them so much. So what are some of the common complaints that acupuncture, chief complaints that acupuncture can help pregnant women?
Really, the main ones that I would see were nausea and vomiting. So throughout the first trimester, and unfortunately sometimes beyond the first
Yeah.
trimester. Reflux is a really common issue that occurs during pregnancy as well.
Yeah.
And musculoskeletal aches and pains.
Yeah.
Um, like going back to what I said before about women calling up just before they want to be induced, it's like if we can make you comfortable and improve the quality of your life again, there's no, like, you don't really need that, like, the desire to get the baby out because they're feeling so bad, it
Yeah.
disappears. So if
Yeah.
you're feeling comfortable, then then it's okay going through all to the due date and whenever labor starts.
Yeah. You brought up a great point, because pregnancy is supposed to be a glorious thing. It's supposed to be through, at least for women, we can't. I don't know about men. So for women, it's supposed to be just a very positive impact in their life. But like you said, if they're suffering through the whole pregnancy, then it becomes a stress that's actually not good for the mom, right?
Yeah, that's right. And there's usually a few, like most of my clients are just acupuncture,
Uh-huh.
and most of them come and see me weekly.
Yeah.
So, you get that, especially mums who have got other kids and who are pregnant the second or multiple times. Having that 45 minutes of your own space in nice and quiet, being able to like completely chill out it's fantastic.
Yeah.
There's not, for a lot of mums, there really isn't that space or opportunity to actually have that at any other time throughout the pregnancy. And so just coming in, you get the needles, and once the needles are in, then people tend to chill out and relax just as part of the acupuncture process. And then you've got the nice and peace and quiet, and not that constant mom, mom, mom.
So, what other benefits can acupuncture provide a pregnant women?
Benefits? How do you mean? Like other than feeling comfortable and having a nice pregnancy?
Yeah, well, they can. It sounds like acupuncture can actually not only does it help the mother, but that translates to helping the baby. That's that's eventually going to be born, and so having that. I don't know, the psychologists, they talk about, when babies are born, if it's a stressful event for them, for the baby, then that creates some stress for the kid as they grow up. And so I'm thinking, if you can use acupuncture to help the mother, be less stressed and have a higher quality during the pregnancy, then the baby's going to be more at peace inside the mom, right?
Yeah, definitely. Yes. And it's quite, it's interesting that babies know when the mother is getting acupuncture, because often the baby can be really quiet beforehand.
Yeah.
And as soon as you start popping the needles in, it's like the baby is now active. It's really consistent.
Nice.
So they know something is going on and something is happening.
Yeah, definitely. Okay, so muscle. What are some of the common muscle skeletal? That's kind of a general category. So what specifically do your patients suffer from muscle skeletal wise, pregnant patients?
Lower back,
Mm-hmm.
upper back, pelvis, sometimes legs.
Yeah.
But that would be the two main ones would be pelvic pain and lower back pain.
Okay. Yeah.
Which is pretty, you can understand why. There's all this additional weight coming on the front, and your center of gravity is moving. And if you happen to have underlying hip issues or lower back issues, then this change often just makes things worse.
Yeah.
Yeah.
Definitely. Okay. And besides acupuncture, do you use any other treatments for your pregnant women?
So I would say nutrition.
Mm-hmm.
Like I always ask about what they're eating and what their diet is, and whether they're drinking enough fluid. And then Chinese herbs on occasion as well. Depends on what needs to be done. Sometimes for pregnant mums who are far more exhausted, then the combination of the acupuncture and the Chinese herbs can really kick goals. Sometimes, I'll generally always check in to see what they're eating or what they're not eating, and just kind of just try to make sure that they're not making common mistakes. I'd say the two most common mistakes that I find is that then they don't drink enough fluid, which is really important more at any time during the pregnancy, but definitely towards the last trimester. So any women who are planning on breastfeeding, they really need to make sure that they're drinking enough, like properly enough, not just I drink maybe a liter. That's like, no, that's that's not going to do you any good. The breast milk is coming from the fluid that you're consuming, and if you're only drinking a liter, that's barely enough for you. That's not going to be enough for you and your baby. And the other one, a lot of women don't eat enough protein. It's like, how do you grow a healthy baby when you're not actually eating sufficient protein to cover your own needs, let alone covering the needs of your baby.
Yeah.
So if you're not eating it, it's got to come from somewhere.
Yeah.
And, you know, it's probably going to come from your muscle mass if you're not actually eating enough of it yourself.
Yeah.
So just, you know, they would be the most two common issues that I try to correct.
Okay. And
yeah,
talking about protein, how much do you recommend that they eat?
As an absolute, ideally around 1.5 grams per kilo of body weight.
Okay.
A minimum of one gram, but even for a sedentary person, I would still say 1 gram of protein is what you should be eating. So anywhere from, for someone who's pregnant, anywhere from 1.5 grams upwards.
Okay. Nice.
Yeah.
So you mentioned that, you know, those are the things that they don't do. What are some things that they're eating that they shouldn't be eating that you see quite a bit?
Soft drink.
Soft drink.
Stay away from the soft drink. It's really, I think most of my catchment, like the women who are already alternate minded, who are going to come and see me, are they're reasonably good. You know, they generally don't drink soft drink, but they kind of, you know, just too many carbs,
Yeah,
chips and sometimes lollies, but yeah, no soft drink.
so definitely
It's just,
sugar is what you're saying.
so sugar.
Yeah, simple sugars.
Yeah. So the issue can come about if you're having too much sugar, even if you don't necessarily end up with gestational diabetes, is that the sugar makes the babies grow really large, or they're much more likely to be able to grow really large from a high sugar diet than a diet that's high in protein and fat. And if your baby's too big, then you end up having complications throughout labor.
Yeah.
If we can avoid that by cutting down on excessive carbs, then yeah, that's a good thing.
Yeah. So big baby means more pain, probably.
Or just medical complications.
Yeah.
Like, if it gets too, like if it's often it may be picked up on an ultrasound. And then, you know, if your plan was to have a natural birth and they pick it up that, you know, you've already got like this massive baby at 38, well, you're going to be booked in for a Caesar.
Yeah.
So, you know, if that wasn't your plan, then, you know, now you're looking at disappointment.
Yeah.
Potentially. Yeah.
Awesome. So what are some, you know, when women come to see you, pregnant women, what are some common questions that they ask you?
Common questions. Oh, the one I had the other day, she was interested in coming for pre-labor preparation. So treatments that help to prepare your body to get ready for the labor process.
Yeah.
She was just kind of really concerned that the acupuncture would induce labor. Her husband works away. She's like, you know, I don't want to go into labor before my husband gets home at like 38.4. So I haven't found that. And the research that I've looked into suggests that the acupuncture is no more likely to promote early spontaneous labor than just the control group.
Yeah.
So there's no statistical significance, but interestingly for her, two of her friends actually had pre-labor and they went into labor early.
Oh.
And I'm like, that's uncommon. I have not come across that.
Yeah. Did you tell her you could deliver it?
Oh.
Any other things that people commonly ask you? About pregnancy, about pre-labor, the preparation for pre-labor and acupuncture?
I would say the most common question with regards to the pre-labor is, am I starting too late? Because usually it's almost hit the 40-week mark.
Yeah.
By the time women have kind of gone, maybe I should look into, something that will help me.
Yeah.
And it's, will the pre-labor prep still be helpful?
Yeah.
In which case I say yes. Because, going back to the examples that I used before, if you're uncomfortable and you're not enjoying your pregnancy, we can actually work on making you comfortable again.
Yeah.
And then, so the last week or however long you've got is much more pleasant.
Yeah.
So it's generally always worthwhile coming in to have the pre-labor. It just, yeah. So that would be one. And I would kind of say in regards to my own philosophical approach to induction treatment, I won't do an induction treatment until they've already got an induction or a Caesar booked, because it's a medical intervention.
Yeah.
It's a medical intervention that is somewhat less hard, less harsh than the actual medical intervention, but it's still a medical intervention. And so if we can actually work towards getting your body into a place where it's balanced, then labor will start spontaneously.
Yeah.
So that's, I guess that would be the common thing. It's like, I'm 39 weeks, I've had enough. Can you induce me? And it's like, no, but I can definitely make you comfortable again.
Okay.
Because if you're comfortable, then this burning desire to get the baby out, it's okay.
Exactly.
You can get through to when labor starts by itself.
Yeah. That's a great point. So when that leads me to, to probably people are wondering, when is the best time? When is the ideal time to start the pre-labor prep?
Generally from 36 weeks.
36
so
weeks?
36 or 37 weeks.
Okay.
And then it's like if you don't have a complicated pregnancy, if everything is going fine, then one treatment a week up to 40 weeks is what I do.
Okay.
And then once we go beyond 40 weeks, then we're more so looking at twice a week treatment.
Yeah.
Up until labor starts. Yeah.
Okay. So let me just repeat what you just said. So typically, ideal situation is start around 36 weeks, right? Where you'll do, typical treatments are one time a week until the 40th week. And if they don't, go into labor, then you may increase the treatments to after that.
Yeah, exactly.
Awesome. Okay. So let's say someone brand new, whether they've never had acupuncture before, or they have had acupuncture, it doesn't matter. And they want to, come in and, whether it's pre-labor or whether it's just pregnancy treatments, they're like you said, they're uncomfortable from the start, like the first trimester. What is your process? What is the process that a new patient has, what steps do they have to go through?
They've got to make contact, so they can give me a call, they can send me an email, they can message me on Facebook. So that would be the first one. After that, once we book the appointment, I will generally send them their initial paperwork to fill out, so they can fill it out on their own time, then they'll bring it in. The first appointment will last between an hour and an hour and a half. Depending on the complexity and how much data I need to gather. So they'll have their initial assessment plus treatment within that first visit. And then the visits are 45 minutes after that. Yeah.
Okay, nice. Any last words about, pregnancy, acupuncture, pregnancy, maybe something that people didn't know? Pre-labor prep, acupuncture.
There's probably a couple things. Use acupuncture for pregnancy because it's fantastic.
Yeah.
I guess that's one thing that lots of people don't know.
Yeah.
With the pre-labor prep, the research that they've done on it so far, It does a couple of things. It makes you much more likely to spontaneously go into labor, which is a really good thing. It reduces the risk of medical intervention. It reduces the risk of having a Caesar. It also shortens labor times.
Nice.
So they're all kind of just win-win-win.
Yeah, yeah.
Yeah. So, you know, if you can get those advantages from coming once a week, then, you know, it's fantastic. It's great.
Yeah, it's well worth it.
Yeah, absolutely.
So if I can summarize, you know, the benefit of acupuncture, you know, of women coming to your clinic to get the pre-labor prep, you know, pregnancy should be an enjoyable time for the mother. And if it's not, then you're definitely missing out, right? Because women don't get pregnant every single year, right? Okay. Yeah. I mean, some have 10 kids, but you know, most women don't these days. And so, you know, having an enjoyable, if you're not enjoying, I would say what I got from this conversation is that if you're not enjoying your pregnancy, then you definitely need the women definitely need to come in and see you, because it should be an enjoyable process. And if you ever have the thinking like, oh, I can't wait till they pop out, you're not enjoying your pregnancy. And so you need to go in and see Chris. The second thing, right? And so the other things, the other benefits, like you said, the win-win-wins is going through that pre-labor prep. Not only is it going to make your quality of life and your pregnancy enjoyable, but it's going to make the delivery process a lot smoother and also somewhat enjoyable, even though you're going to be in, right? You're going to be in intense pain, but it will be less.
Yeah, the research suggests it'll be shorter.
Yeah.
Yeah. Yeah.
So if you do want to go through natural labor, you know, then the acupuncture can help with that, instead of having to go through the C-section route. And so really there's no, you know, negatives to having acupuncture during pregnancy. Actually, it's all positives.
Yeah, it's all good.
Yeah. Awesome. Great. So where can
actually, sorry, just to interrupt. The research says it's safe. That's the other thing I should say. The research just consistently, all the studies just they say it's safe.
Yeah.
So if that's a concern, then just jump online and you can have a look at the research, and yeah, it's safe.
Yeah, that's a great point. So basically, you know, you have two kind of research. You have time-based research, which is acupuncture has been used for 3,000 years for labor. So if it wasn't safe, it wouldn't be practiced right now, you know. And then you're saying that there's also current research that just proves the 3,000-year-old research. So no matter what research you look at, acupuncture is safe for pregnant women.
Yeah.
Awesome. Okay. Any other things that popped into your head that you want to share?
No.
Okay.
I think I'm good. Yeah.
Where can people find you?
So you can find me at my website, which is happylaughter.com.au. You can find me on Facebook, which is, I think if you Google Happy Laughter Acupuncture, you should be able to find me.
Okay.
Or that would be the main two ways. Or Google.
Okay. Nice.
Google Acupuncture Lilydale, and you'll find me too.
Nice. So if anybody has any questions about pregnancy, after listening to his interview, you still have questions, contact Chris. He can definitely answer your questions and let you know, again, reassure you that it's safe, because that's what he does. He's the expert at doing this. So there's no better person to go ask about pregnancy, pre-labor prep than Chris Mills. Well, Chris, I appreciate your time. I know it's early in the morning in Australia, so I appreciate you getting up super early and sharing all of this, dispensing all of this knowledge to us.
That's great. Thanks a lot, Jimmy.
All right, Chris.
It's been a pleasure.
Same here. All right, I'll talk to you later. Okay.
Yeah, shout out. Thanks. Bye.